Hi, Christina. Thank you so much for taking your time to speak with me today. To start off, what were your first impressions when arriving at the Central Alberta Child Advocacy Centre?
Thank you for having me. The very first thing I noticed was how big and colorful the building is, even just from the outside. When you walk in, you're immediately met with this feeling of calmness. It's clean, bright, and welcoming. I didn't know exactly what to expect going in, but I had heard it was a warm and inviting space, and it truly didn't disappoint. As we toured the public and visiting areas, it felt more like a women's retreat than a clinical building. It was such a comforting environment.
That's amazing to hear. How did you feel when seeing the actual spaces where interviews take place?
Honestly, I was really moved. The interview rooms felt incredibly safe. That's something I noticed and appreciated right away. So often, victims are taken to police stations and are interviewed in the same rooms where criminals are questioned. That kind of cold, intimidating space can make someone shut down entirely, especially if they're already going through trauma. But at CACAC, everything felt so thoughtfully designed to give people a sense of safety and dignity. The environment could be the difference between somebody opening up and someone staying silent.
Were there any particular features in the space that stood out to you?
Absolutely. The therapy dog, for one, I thought that was an amazing idea. For someone who's experienced abuse, it can be incredibly difficult to trust people. A calm, gentle dog can help regulate the nervous system and give someone just enough comfort to feel safe sharing their story. The cozy blankets and the love bugs were such thoughtful touches too. You could tell that every piece of the space was designed with purpose to make people feel seen, valued, and supported. It sends a powerful message. You're not a burden, and your story matters.
Let's talk about your interactions during the visit. How did they match your expectations?
It was actually a bit different than I had expected. I thought the visit would be more interactive, maybe more one on one conversation, but instead we sat in a lecture. Even so, what really stood out was Ronnie. Her passion for her job came through immediately. It takes a special kind of person to do this work well, and Ronnie clearly pours her heart into it. She always is seeking feedback and finding new ways to raise the bar when it comes to patient centered care. Her creativity, drive, and empathy are setting new standards for how mental health and crisis response services should be delivered.
As a nursing student, how did this experience shift your perspective on your future role?
One of my biggest takeaways was the importance of being educated about resources. As nurses, we don't have to be experts in every specialty, but we do need to know who to call. If a patient comes in needing a sexual assault nurse examiner and no one on our unit is trained, we need to be able to act fast and get the right person involved. Knowing that the CACAC exists and understanding the kind of care that they provide means I now have a resource I can trust when someone in Stettler needs some help. The visit reminded me that being a nurse isn't just about the physical side of care, like IVs or wound dressings. It's also about mental health and emotional well being. We have to be prepared to advocate for our patients in all aspects in their care.
Were there any specific practices mentioned during the lecture that impacted you?
Yes, in the personal communications lecture, Ronnie highlighted the importance of routine abuse screening. It's not something optional, it's essential. The moment where a nurse asks the right question might be the only window someone has to speak up. Just asking could be the lifeline that changes their entire future. That really hit home for me.
Did the experience challenge or change any of your personal beliefs?
I've always had a soft spot for people dealing with trauma and abuse, so my core beliefs didn't really change, but I did realize something. I hadn't really thought about the male victims of abuse, especially those being abused by female partners. It's not as commonly talked about, and unfortunately, that often leads to being overlooked, even by healthcare professionals. Ronnie mentioned that abuse towards men is more likely to be dismissed or missed entirely, and that really stuck with me. I'll be a lot more intentional about asking screening questions to all genders going forward.
Was there any stories or media shared during the lecture that particularly stood out to you?
Yes. Ronnie showed us a YouTube video about Alex Skeel, a man who was severely abused by his partner. When he first sought help, no one even considered it to be domestic abuse. If his injuries had been on a woman, I'm sure it would have been taken more seriously. That story really drove home how important it is to not make assumptions based on gender.
Did anything discussed connect with your understanding of the social determinants of health?
Oh, absolutely. According to the Government of Canada, the long-term effects of childhood trauma are staggering. For example, 44% of women and girls who witnessed abuse at home ended up in abusive relationships as adults. Women with a history of physical or sexual abuse before the age of 15 were about twice as likely to end up in an abusive relationship later in life compared to those without prior abuse. And women aged 15 to 24 who experienced abuse reported symptoms consistent with PTSD. Those numbers are heartbreaking. It shows how abuse can carry forward and affect every aspect of someone's life: relationships, safety, and mental health. These outcomes are deeply influenced by social determinants of health, such as early childhood experiences, education, access to safe housing, socioeconomic status, and social support networks. As nurses, we have to recognize and respond to these underlying factors if we want to provide truly holistic, trauma-informed care that supports long-term healing and safety.
Do you have any final thoughts or takeaways from this experience?
Just that this experience really affirmed why I want to be a nurse. It's not just about skills, it's about heart. It's about making people feel safe, advocating for them, and being someone they can count on in their darkest moments. Knowing that places like CACAC exist gives me hope, and I want to be part of that kind of care, where every detail says you matter. As healthcare workers, we must provide a safe place for our patients. Being aware of the social determinants of health can provide key elements to look for when meeting with our patients. Although we must not discriminate, it can be an important tool for healthcare workers to know the population that is higher at risk for domestic or sexual abuse. Noting a patient's social supports and coping skills can help us determine if our patients have a safe place or a person to turn to if they ever encounter an abusive relationship. Income and social status is something that is also important to note, as many living with abuse may stay in a relationship because they feel they have no place else to go. Past history of abuse statistically has proven that those patients are at greater risk for encountering another abusive relationship. Healthcare workers can use this knowledge for better patient-centered care and allows us to be better equipped to offer support and security for patients when they reach out for help. Taking the right steps to support these vulnerable populations, we must complete abuse screenings on all patients regardless of gender. Know the resources your facility has available for patients who reach out for help and ensuring you are remaining discreet. This is extreme importance to the safety of your patients. As healthcare providers, we must advocate for our vulnerable populations and ensure that we are striving to give patients a safe place to speak out.